Hi there, to make things easy, we're both vestibular audiologists called Jess.
I'm Dr. Jessica Vitkovic from Dizzyology in Mount Waverley.
And I'm Jessica Blakeley from Ears in Balance in Chelsea.
Together we have created 7 quick videos each day for Balance Awareness Week to explain how your balance system works, what happens when it doesn't, and how we as audiologists can test it.
Follow along each day to see how lollies
And giant glitter bracelets
have anything to do with your balance.
So let's discuss the balance system as a whole. Now our balance system is made up of information coming from our eyes, our ears and our muscles.
And this information is used by our brain to work out where we are in space, if we're moving, standing still or tilting our heads. Now this system isn't something that we usually think about until it goes wrong.
Now most of us may have lost our balance at some stage. A lot of us have experienced vertigo too. Now whether it's that feeling like you're still on a boat after getting off, or that head spinning feeling you might get after one too many drinks. But for these examples, you know why you feel like that and it doesn't last too long.
Imagine feeling like that without knowing why. Here is an example of a person who has an error message coming from their ears. Because the systems are connected, we can see and understand this error by recording their eyes.
Did you know that each ear has 5 balance organs? And we'll be discussing these in detail in videos to come. But what we do as audiologists is try to work out if it's your inner ear that's not working, and if so, which part. Knowing which part of the inner ear isn't working can help us work out what has caused your symptoms in the first place, which means your symptoms will be appropriately managed.
During our appointments, we explain our results and how they relate to your symptoms, because understanding what's going on can start to make things feel a little less scary. Previously, we mentioned there are 5 different organs or parts of the inner ear that are dedicated to balance. Today, we're going to talk about 3 of these, which can be found in each ear, called the semicircular canals. These canals are tiny, fluid-filled tubes that sit in different orientations to detect all ranges of head movement. They are also responsible for one of the most important balance reflexes that allows you to keep a stable image on your eyes when you're moving.
When these parts of our balance organs don't work effectively, this reflex is inadequate, and you could experience something like this, particularly with fast head movements, which can also be associated with a perception of dizziness. Sometimes when one ear isn't working, it can cause us to feel things like spinning when we shouldn't. However, if both ears aren't working, then we may not feel movement when we should.
We'll show you how we test them tomorrow.
Let's talk about how we test the semicircular canals in clinic. Because the eyes and the ears are connected, we can see what is happening with the ears, specifically the semicircular canals, by recording our eye movements.
For this test, we get the patient to look at a spot on the wall, and then we turn their head from left to right. For the patient to keep their eyes on that spot, the ears have to tell the eyes exactly how far and how fast the head has moved, so that the eye can move in the same way but the exact opposite direction.
Moving the head side to side tests the horizontal canals in each ear, and turning the head to one side and then moving it up and down will test the posterior and anterior canals.
These goggles then give us a graph to show us if the eye was able to keep up or not. So this test is simple and it quickly allows us to diagnose if there's a problem with any of the semicircular canals. Today we're going to talk about the other 2 parts of the inner ear dedicated to balance, and this is where we get to use lollies. Fancy words for this part of the ear is the utricle and the saccule. Now, like these lollies, they have a jelly layer coated with what we call otoconia, or maybe you've heard crystals or ear rocks.
You actually do have rocks in your head.
Now, your otoconia aren't made of sugar like this. They're as dense as granite and can come loose and fall into the semicircular canals, causing all sorts of havoc. But we'll talk about this another time.
So these guys are our internal accelerometers. Now our utricle sits flat and detects stop-start motion like when we're driving, but our saccule sits vertically and detects up and down motion like when we're in an elevator. The otoconia also move in the jelly layer when we tilt our head, which tells our brain where our head is in space.
If one of these parts stop working, it can make us feel like we're rocking on a boat, or we ourselves can become tilted.
We'll talk about how we test these tomorrow. So yesterday we talked about the utricle and the saccule, or the lolly parts of our ears, but today we want to show you how we test them in clinic.
We've also talked about how the ears, the eyes and the muscles are all connected. So for these tests, we activate the ear either with sound or vibration and record the response from the muscles.
Now to test the saccule, we record the information from the neck muscles, but you can only do so when that muscle is turned on. And this means that for this test, we get the patient to lift up their head when they hear the clicks in their ears. Now for the Utricle test, we record the muscle under the eye in response to vibration or tapping on the forehead.
While these tests might look weird, they don't cause you to feel dizzy.
Today, we're going to cover one of the most common causes of vertigo or spinning sensation called BBPV. This stands for
B.
Benign. It's not dangerous even though it can feel really scary.
B.
Paroxysmal, which means it comes on suddenly, builds in pace and then slowly dies down within seconds to minutes. With the second
P.
That stands for positional changes, which means the condition is brought on by specific head and body positions. And the
V.
is for vertigo, the spinning sensation that you feel.
Do you remember the fluid-filled canals and the sugar rocks? In this condition, the sugar rocks, or otoconia, come loose and end up in one of the semicircular canals. Here, it's demonstrated by the glitter. When we change our head position, such as look up, the otoconia keep moving through that semicircular canal and they signal to the brain that we're spinning. If your symptoms last longer than a minute and aren't brought on by this head movement, it's unlikely that you have BBPV.
Now to test for BBPV, we lay the patient on their back and record their eye movements. If the test is positive, we'll see some specific types of eye movements, and that depending on the way they move, it tells us which semicircular canal the otoconia have ended up in. This then allows us to perform the appropriate head and body movements to move the otoconia back out of that canal.
90% of the time, the otoconia will be in the posterior canal. And the test that we use for this is called the Hall pike, and the treatment is the Epley manoeuvre. Now, this condition is fixable, so if you aren't getting better with these exercises, it means your symptoms are being caused by something else, or those otoconia keep falling back out. In both of these cases, it's likely you're going to have to see a specialist to work out firstly what's going on, and then how to manage your symptoms appropriately.
But to summarise, BBPV is one of the most common causes of vertigo, but it's also the easiest to test and to treat.
For our final video, we're going to talk more about our services. You'll need a referral from your GP, ear, nose and throat specialist or neurologist. Our services are bulk billed, so there's no out-of-pocket costs.
We'll spend up to 2 hours with you asking questions about your symptoms, testing your ears, explaining the results and what our recommendations are moving forward. We often refer and work with vestibular physiotherapists, so if you're experiencing any ongoing imbalance or have BBPV.
We might also recommend seeing an ear, nose and throat specialist, neurologist or neuro-otologist, depending on our findings. After our assessments, we'll then send a detailed report back to your referring doctor.
If you'd like to learn more, head to our websites or vestibular.org, links are below.